talk to me. You're going to be my dress rehearsal.
Okay, I'm sharing now.
Hey, how are you? I'm Saitta. I'm Chief Digital Officer for iVenturesHealth and Omnicom Health Group. And at iVenturesHealth, we formed a technology division that was focused on developing platforms to solve problems in healthcare communications. And today I'm just going to share 2 platforms with you. They're both patent pending, and we are excited that you're joining us. Because we believe technology inspires healthy communications. And so we've put our focus and our time and our talent to doing a few things. Number one, we want to stay focused on healthcare only. We want to solve problems for our clients, and we want to address the inefficiencies that we see in digital as well as ineffective communications. So we're set out to uncover emerging technologies and bring them to our clients to solve these problems. One of our patent-pending technologies is a tool called DriiverSeat, and it allows co-navigation by touching 2 iPads, which actually makes a difference in how the people who are touching those iPads actually retain the digital content inside. And specifically, we looked at doctors. How do doctors behave when they have iPads in their hands and they can actually interact with digital material? And what we found is that, first of all, over 65% of healthcare professionals love using their iPad. 35% of them that interact with an iPad during a discussion with a sales rep are more likely to prescribe a sample or provide a sample, and 29% are more likely to prescribe the drug. So we had an idea. We had an idea of bringing 2 iPads into a doctor's office and actually providing one to the physician so that they could interact and drive the digital content just as easily as the sales rep could do with highly compliant digital material. Where if one person changes the screen, the other person sees the changes on the screen. And co-navigation can actually pass easily between both the doctor and a sales rep. So to put it quite simply, DriiverSeat allows 2 iPads to communicate. With iDetails, it allows a doctor and a sales rep to co-navigate compliant digital material. And it finally removes the problem of a one-way dialogue between a sales rep and a physician, where both parties are in the driver's seat. We found that when we put this in our field, in a pharmaceutical field force, 56% of the sales reps receive positive insights and feedback from our physicians. 78% of our reps said, hey, this is easy to use. And what we found was interactions with doctors were driven up to about 7 minutes. 33% of the reps said it actually improved the quality of their interaction with the doctor. And as I said before, doctors are 35% more likely to ask for a sample and 25% more likely to prescribe the drug when they're interacting on an iPad. So that's DriiverSeat, and if you stop by the iVentures booth, we've got some more material and videos, and if you come see me at 4:30, we'll show you some live demonstrations as well. One of our next products, or the next product, is a tool called VIA. And again, our focus is around solving problems in healthcare communications. This problem is actually one that we addressed inside healthcare agencies. How can we seamlessly move critical, compliant healthcare assets through an agency? One that routes, reviews, and it actually allows our clients to comment on materials. We call that tool VIA, a custom workflow app developed by iVenturesHealth with a proven track record of effectiveness for brands and pharmaceutical companies. It's intuitive for both departments and individuals, and if you work for an agency, some of this might resonate with you on how a challenge it can be to move work from one department to another. But this is mobile friendly, and it allows all comments to be integrated as well as reported back to clients as needed. I'm going to show you a few screenshots of VIA, but I invite you back to the booth at iVenturesHealth to see things like how this user-friendly tool allows healthcare agencies to assign work across departments. It allows an individual to see, where am I in the queue, or where's my work in the queue? It allows me to look at all the jobs in my queue and a simple dashboard that's user-friendly and easy to navigate. Job routing is a big deal in any agency, and quite frankly, most agencies are still doing this by paper. What VIA does is it removes paper, it removes inaccuracies, and it actually increases the quality and speed in which healthcare assets are processed within an agency. It's also got some tremendous features in marking up video and web, which in a digital world are on the rise across all of our healthcare clients. One of the other things that's super important in healthcare are approvals, auditing, and making sure that we're compliant. And with our new platform, we're able to track, verify, and audit ourselves and provide this information to our clients. Inside of the agency, we need to make sure that we are on time and on track. Automated hot sheets let us do that in a very streamlined and easy way. Lastly, we want to make it easier on our clients. When assets are ready to go to a healthcare client that need to get approved, or perhaps we're in the middle of getting a government compliance, we're able to integrate online with our clients and again, make it easier. Take it out of email, take it out of PDFs, and make it easy for the approval process and one that's auditable and trackable. So we've got a 7-year track record in supporting agencies globally with our platform, over 900 pharmaceutical brands, over 1 million routes of assets per year. And we've 100% reduced inefficient processes and eliminated paper. We manage close to 15,000 jobs a year. So if you'd like to learn more about VIA, please stop by the iVentures booth. We'll share with you some more details, live demos, and we'd be happy to talk to you about it at your company.